According to the World Health Organization, or WHO, breast cancer became the most common cancer globally as of 2021, accounting for 12% of all new annual cancer cases worldwide. Over 2 million women are diagnosed with breast cancer globally every year, with just under 100,000 deaths. And 1 in 7 women will be affected by breast cancer. So what are the 2 risk factors for developing breast cancer? They're being female and growing old. Now, of course, there is nothing we can do to change these 2 factors, but there are certain lifestyle behaviors we can change that have been shown to minimize the risk of developing breast cancer. These are the 3 factors. Number 3, reduce alcohol intake. More than 100 studies have looked at the association between alcohol consumption and breast cancer in women. And although these studies are observational, which means that they draw on inferences from researchers, the results seem to come to the same conclusion. Alcohol intake increases the risk of breast cancer. It is estimated that drinking 2 units a day causes an extra woman out of every 50 to develop breast cancer. Now, we don't really know conclusively how alcohol affects breast cancer risk, but we can make some reasonable deductions. Alcohol can increase estrogen levels associated with breast cancer development, and alcohol can also cause weight gain, which in turn can increase breast cancer risk. Now, having said that, people who don't drink can also get breast cancer, so it doesn't mean that you can't have a drink at all. It means that you need to be sensible in the amount of alcohol that you drink. UK National Health Guidelines recommend that women drink no more than 14 units a week. This is the equivalent of 6 pints of lower strength beer or 6 175 milliliters glasses of wine a week. Now, there are ways to cut down alcohol. Choose drinks with less alcohol content, for example. You should probably track how much you drink in a week. Space out your drinking days and have days off when you don't drink. Or you can choose not to drink at all. Number 2, maintaining a healthy weight. This is of course beneficial for health in general. We know that a high BMI, or body mass index, in postmenopausal women increases the risk of breast cancer. High levels of body fat have been thought to increase postmenopausal breast cancer risk through increasing estrogen bioavailability. And so maintaining a healthy weight can be achieved by the number 1 thing that we can do, by keeping active. We know that physical activity and staying active has a positive effect on our general health. This is especially beneficial in minimizing the risk of developing breast cancer. A recent study published in the British Journal of Cancer investigated just under 200,000 women with a mean follow-up of just under 6 years. A total of over 3,000 invasive breast cancers were diagnosed in these women. And it was found that physical activity was associated with breast cancer risk reduction in both premenopausal women by 23% and postmenopausal women by 17%. So how much exercise should we do? Well, the recommendation is to do 150 minutes of moderate activity per week. So that's about 30 minutes on at least 5 days during the week. And moderate exercise is any movement that makes you slightly warm and a little bit out of breath, but you're still able to talk. So this can be anything from cycling, walking, dancing, gardening, or even doing household chores. But the truth is, any movement is better than no movement at all. From the point of view of cancer, we can only minimize the risk. We can't stop cancer from happening. And so it's important to be able to know what to look out for when examining your breasts. You need to look out for a number of signs, which I have described in a separate video, and I will link that in the description below. I'll see you in the next one.